Be ahead of everyone else with the First Alert Weather Team.
So we've been telling you all month about American Heart Month and how all of us women and everyone needs to be taking better care of themselves and their hearts. Dr. Todd Monroe is a cardiologist with ProMedica Health Systems with what to watch for and little changes that we can all make to love our hearts. Good morning. Thanks for being here today.
Thanks.
It is that month, February, where we talk about heart disease. It's the #1 killer of really, we say women, but everybody, right?
Yeah.
So chances are somebody in your family even, you've come across heart disease. But for people who don't have that experience, kind of just explain what heart disease is. I would imagine, I mean, we hear heart attack, right? But are there different levels of heart disease?
So heart disease takes many forms. One is the typical, which is coronary artery disease, which is probably most people have heard about with heart attacks. But there's other forms of heart disease. There's congestive heart failure, which can also be the result of a heart attack. There's cardiac arrhythmias, atrial fibrillation, and other heart arrhythmias that can occur. And so heart disease kind of encompasses a great deal of things regarding the heart.
Okay, so what are some of the risk factors involved? I mean, is this is there a genetic predisposition at all to this?
There is. That's probably the #1 risk factor, which is the family history is the most important. And so we generally think of people who have a first-degree relative before the age of 60 who has a heart attack, bypass surgery, a stent, or stroke.
Okay.
The offspring of those people are going to be at higher risk. Less important are the secondary relatives, but still relative. The other risk factors are the things that you can control. You can't control your genes, but you control the other things. So you can control your blood pressure by exercising and in some cases having to use medication. Cholesterol, which is also probably genetic to some degree, trying to eat right and trying to exercise as well for that. Other things, diabetes, which again also can be genetic, also predisposes to heart disease. And then the other worst one besides family history is smoking.
Okay, and that's something, yeah, you could certainly prevent, you know, just
absolutely.
There are people out there, there's services and programs available to help people quit smoking. And also, I would imagine that ProMedica has some services available too.
We do have through the Heart Institute, we have ways that people can contact us regarding heart-healthy diets, heart-healthy exercise, and smoking cessation.
Okay. When we talk about eating healthy, we talk about exercising. These are just a couple of things. I mean, can you start small and grow? Or?
Absolutely. I mean, I think the couch and the easy chair are your enemies, and being active is the most important thing. When we tell people to exercise, we generally want them to exercise 30 minutes a day, probably 4 or 5 days a week, but it can be as simple as just walking. Like I said, sedentary lifestyle is very much an enemy for people. So we know that two things that are the most important thing that helps stabilize coronary arteries and preventing heart attacks is exercise.
Just get moving, you know. And this time of year, I know it's hard to get out. Obviously, it's cold and whatever, but maybe try using the stairs, you know,
absolutely. Stairs
at your workplace or at
absolutely.
your home.
It doesn't have to be, a high level of exercising. It is using the stairs instead of the elevator. It is doing things around the house, mowing the grass, raking leaves. Shoveling snow is always one of those things that people worry about with heart attacks. Shoveling snow by itself probably is not a problem. It's when the person chooses for that to be their first exercise.
Sure, yeah, we want to make sure you're
in better shape.
In better shape before you get out there, with the heavy snow shovel in the snow. Some things to consider. We want everybody to just kind of be aware of that. This is the #1 killer in everyone. Right? It's the #1 killer. So we just want people to be aware that heart disease it's real, and we want you to start living a healthier lifestyle. So
if somebody thinks that they're having a problem, we have a board-certified cardiologist at Toledo Hospital that's there 24 hours a day. So we are there waiting in case you have a problem.
Okay. All right. Thank you so much.
Okay, great. Thank you.
Okay. Next on Toledo's only live local 9 a.m. show, you're living in the middle of history. Toledo is full of historic sites and stories.